Hi, this is Dr. Garza with PRMA Plastic Surgery. One topic that's been coming up recently is the difference between a cosmetic breast augmentation and reconstruction with implants for breast cancer. So when I have patients that have questions regarding this, I like to use examples. One of the examples I like to use is with a drawing, which I have here. When you're looking at the soft tissue envelope in a cosmetic breast augmentation, you have much more soft tissue covering the implant, and that's going to come into play. I'll describe a little bit later. But one of the things you'll notice is you have the skin layer, then you have a fatty layer underneath the skin surface, and then under that you have your actual breast tissue. If the implant is placed below the muscle, then you'll have a muscular layer, and then the implant. So you have this large soft tissue envelope which covers the implant and masks any portions of the implant that might be visible. Okay. Of course, if the implant is placed above the muscle, you lose this little layer, but you still have a relatively thick layer covering the implant. In a breast reconstruction, the situation is completely different. You have your skin envelope. You have a layer of fat which is now thinner because you've had to place a larger implant to account for this soft tissue loss. So you have your skin, your subcutaneous fat, and then you have a muscular layer. Again, majority of implants used in reconstruction are placed underneath the muscle, and that's just to help hide or mask any rippling within the implant. Again, you've lost all the breast tissue because that's been removed during the mastectomy. To make up for that, again, you have to use a larger implant. So this soft tissue envelope becomes thinner as it's stretched out during the tissue expansion process in the breast reconstruction process. So that leads to a smaller amount of tissue covering the implant, which again is a larger implant, and that can lead to issues with rippling. Some of the things we use to counteract that would be involved in that second stage in the reconstruction process, and we do fat grafting to help counteract some of those visible portions of the implant. Also choosing the implant very carefully and knowing when to stop the tissue expansion process so you don't have too thin tissues. We'd love to give every patient the size of implant or cosmetic result that they would like, but the larger the implant you use, you're going to put more strain on the soft tissues. In addition, you can also have more visual rippling that's apparent when you have the tissue stretched out to that degree. The other example I like to use is a visual example because I think that helps kind of solidify the concept that I try to get across, and that's with this bowl of fruit we have here. I usually don't have a bowl of fruit when I do the consultation, but for our purposes here, it's very, very nice to have this. So if you picture a bowl of fruit and you picture covering the bowl of fruit with a very thin sheet, which is, in this example, the soft tissue in a breast reconstruction. You cover this bowl of fruit with a very thin sheet, you're going to be able to see every little contour and subtle irregularity within the fruit bowl. So you see here, you can very clearly see that there is definitely some fruit under there. Now, this would be the example for a breast reconstruction with the thinner soft tissue envelope. Now, if we use the same bowl of fruit and cover it with a thicker portion of blanket, which would be the example for a breast augmentation where you have a healthier soft tissue envelope, it's very hard to discern the fruit underneath this blanket here, and that's the point that I try to make across with an implant. So you see, this is the newest generation of implant. This is a 5th generation implant, the so-called gummy bear implant. So it has a very highly cohesive gel, but even still, the newest generation of implant will still have some rippling noted in the implant. And again, this is something that can be visible when you have a breast reconstruction with an implant. Again, the things that we do to try to help mitigate the visual effects of the rippling is placement of fat grafting. And all fat grafting is trying to do is build up that soft tissue envelope to mask this rippling within the implant. So we're trying to get a thicker blanket, so to speak. So that's pretty much the difference between the reconstruction for a breast augmentation versus a breast reconstruction.